Hello everyone, and welcome back to our channel. Today we're rediscussing a very important topic that affects many families: common symptoms of lung cancer in the elderly. As we get older, it's easy to dismiss new aches or changes as just part of aging. But some signs should never be ignored. Our goal today is to empower you with knowledge so you can take proactive steps for your health or the health of your loved ones. Please remember, this video is for educational purposes, and it's crucial to consult a doctor for any health concerns. Let's start with one of the most common signs: a persistent cough. We all get coughs now and then, but a cough related to lung cancer is different. It's a cough that just won't go away, or even seems to get worse over several weeks. It might change from a dry cough to one that produces mucus. A particularly alarming sign is coughing up small amounts of blood or rust-colored phlegm. While other conditions can cause this, it's a symptom that always warrants an immediate doctor's visit. Don't just brush it off as a smoker's cough or a lingering cold. If a new cough lasts for more than 3 weeks, it's time to get it checked out. Next, let's talk about shortness of breath. You might notice feeling out of breath after activities that used to be easy, like walking up a flight of stairs, carrying groceries, or even just walking across a room. In some cases, this breathlessness can happen even when you're resting. This occurs when a tumor blocks a major airway or when fluid builds up around the lungs, a condition called a pleural effusion. It's easy to attribute this to being out of shape or simply getting older. But a new or worsening shortness of breath is a significant signal from your body that something is unright. Pay attention to whether it's a gradual change or a sudden onset. Another key symptom is chest pain. This isn't always a sharp, dramatic pain like a heart attack. It can be a dull, persistent ache in the chest, shoulder, or back. The pain might get worse when you take a deep breath, cough, or even laugh. This discomfort can be caused by a tumor pressing on nerves, growing into the chest wall, or causing inflammation in the lining of the lungs. Sometimes the pain isn't even in the chest. It can be felt in the shoulder or arm if the tumor is located at the very top of the lung, a condition known as a Pancoast tumor. If you have unexplained chest pain that doesn't go away, it's essential to seek medical advice. Now, let's discuss fatigue. This isn't just feeling a bit tired after a long day. The fatigue associated with lung cancer is profound and overwhelming. It's a feeling of complete exhaustion that is unrelieved by rest or a good night's sleep. This happens because the cancer cells compete with your healthy cells for energy and nutrients. The body is also working overtime to fight the cancer, which drains your energy reserves. If you or a loved one feels constantly wiped out and lacks the energy for daily activities, this pervasive weakness shouldn't be ignored. It's a common symptom for many conditions, but in combination with others we're discussing, it becomes even more significant. Have you noticed a change in your voice? Hoarseness, or a raspy, strained voice that lasts for more than a couple of weeks can be a subtle sign of lung cancer. This can happen if a tumor presses on the laryngeal nerve, which controls the muscles of the voice box, or larynx. Your voice might sound scratchy, weak, or change in pitch. Again, it's easy to blame this on a cold, allergies, or acid reflux. But if the hoarseness persists without a clear reason, especially if you're a smoker or former smoker, it's a good idea to have a doctor take a look. One of the most concerning symptoms is unexplained weight loss. This means losing a noticeable amount of weight, say 10 pounds or more, without changing your diet or exercise routine. You might also experience a loss of appetite, where you just don't feel hungry or you feel full after eating only a small amount. This happens because cancer can change your metabolism and the body may release substances that cause you to lose weight and muscle mass. This symptom, often called cachexia, can be a sign of more advanced disease, so it's critically important to address it early. Another red flag is frequent lung infections. If you find yourself repeatedly battling bronchitis or pneumonia, and it seems to take longer and longer to recover each time, this could be a sign of an underlying issue. A tumor can block an airway, creating a perfect breeding ground for bacteria and leading to infections that keep coming back in the same part of the lung. So, if you're on your third round of antibiotics for a chest infection that just won't clear, it's time to investigate further with your doctor to find out why these infections are recurring. Let's also talk about wheezing. Wheezing is that high-pitched whistling sound you make when you breathe, especially when you exhale. It happens when airways become constricted, inflamed, or blocked. While it's most commonly associated with asthma or allergies, a new onset of wheezing, especially in an older adult who has never had it before, can be a symptom of lung cancer. A tumor can partially block an airway, causing the air to make that sound as it squeezes through. If wheezing is new for you and doesn't go away, it's another reason to schedule a doctor's appointment. A less common but very serious symptom is swelling in the face or neck. This can occur if a lung tumor, typically in the upper part of the right lung, grows large enough to press on the superior vena cava. This is the large vein that carries blood from your head and arms back to your heart. When it's compressed, blood can back up, causing swelling in the face, neck, arms, and upper chest. You might also notice headaches, dizziness, and a bluish tint to the skin. This is a medical emergency known as superior vena cava syndrome, and it requires immediate medical attention. Finally, let's touch upon bone pain. If lung cancer spreads or metastasizes, it often travels to the bones. This can cause pain in the back, hips, ribs, or other bones. The pain is often described as a deep ache that gets worse at night and doesn't improve with rest. It might be a new pain that you can't link to any injury. In some cases, the cancer can weaken the bones, making them more likely to fracture from a minor injury or even from normal daily activities. Unexplained, persistent bone pain, especially in the back, should always be evaluated by a healthcare professional. Now, it is incredibly important to state this clearly. Having one or more of these symptoms does not automatically mean you have lung cancer. Many of these signs are also common in other, less serious conditions that are prevalent in older adults, such as COPD, heart disease, pneumonia, or even acid reflux. The key is context and persistence. Are the symptoms new? Are they getting worse? Have they lasted for more than a few weeks without a clear explanation? If the answer is yes, then it is absolutely crucial to see a doctor. Don't wait. Early detection is the single most important factor in successfully treating lung cancer. Your doctor can listen to your concerns and may recommend simple, painless tests like a chest X-ray or a CT scan to get a clearer picture of what's going on in your lungs. Taking charge of your health means listening to your body and advocating for yourself. If something feels wrong, speak up. We hope this information has been helpful and empowers you to have those important conversations with your doctor. Thank you so much for watching today. If you found this video valuable, please give it a thumbs up and share it with friends and family who might benefit. Don't forget to subscribe to our channel and click the notification bell so you don't miss our future health updates. Stay safe, stay informed, and we'll see you in the next video.